We have today Mr. Joe DeMelfi. Joe is 63 years old. He's been my patient for 18 long years. And he's been on testosterone replacement since March of '07, so that's 22 months. What was bothering you before we started you on testosterone replacement?
Well, I was getting tireder and tireder, and I felt like, what you call it, that, I was losing a lot of energy. And, with everything around me, what you call it, like I got up in the morning very tired, what you call it, it had to do with a lot of things, a lot of things.
A lot of things.
Yes.
And besides the fatigue, sexually?
Sexually.
What was happening with that before the testosterone?
I found out that my sex drive wasn't good at all.
You weren't pleased with that?
No.
And how long had these two things been going on?
A couple of years.
And were they stable or getting worse?
They were getting worse.
Progressively worse?
Yes.
And you also, you were nervous at that time?
Very nervous.
Very nervous?
Very nervous.
And
the slightest thing would tick me off.
You had a short fuse?
Short fuse.
Okay. Then we started you on testosterone in March of '07, and what did the testosterone do?
Well, it made me more alert. I had more energy, and my sexual attributes felt more alive.
More alert?
Yes.
Mentally alert?
More mentally alert.
Uh-huh.
Especially when I came to the doctor's office.
And how much more energy did you get?
More energy.
A lot? A little?
Significantly more.
And the sexuality also significant?
Better.
Yeah.
Better.
Okay, and what happened with the nervousness?
The nervousness started to taper off. I wasn't as uptight or as nervous as I was in the past.
And the fuse, the short fuse, did it get longer?
Shorter.
You mean shorter means that you got set off more quickly?
Well, I wasn't as, things didn't anger me as much as before.
Okay. And was there a significant difference in that?
Yes.
Okay. Now, you also recently had a total hip replacement done.
Yes, I did.
That was just 3 months ago.
Yes.
And tell us about the recuperation from that.
Well, the first day after the surgery, I was out of bed walking. I walked out of bed and I was walking down the hall with the walker. And the doctor who operated on me and the head nurse were extremely surprised that I was walking the very next day out of bed down the hall with the walker. They said that's a lot of improvement for only one day out of the operation.
And the rehabilitation went along smoothly? You went to a rehabilitation facility?
Yes.
And was anything said there about your rate of progress?
Yes. They said I'm improving significantly better than most people there.
Okay. That's what usually happens. Have you had any side effects to this testosterone replacement?
Like what?
Well, I don't know, anything. Any side effects? Anything negative about it?
No.
No.
And anything I can say about testosterone is that it's improved my life and it's improved my health.
Mm-hmm. Has there been any change in your sense of self-confidence or self-esteem or how you feel about yourself? Has that changed at all?
I feel very confident.
More so than before the testosterone?
Yes, definitely.
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 Significant difference.
Significantly difference.
A lot of people say that they feel happier since they've been on testosterone.
Well, I'm happy most of the time.
You're a happy guy as it goes, yeah.
Yes, I'm especially happy when I come to see my doctor.
Yeah, it was hard for you to get happier. Okay, thank you, Joe. I really appreciate it. You're a good guy.
My pleasure. My pleasure.
Okay.